And here he is, the man who won So You Think You Can Suck, Steve Perry!
I have not said that I was a single-payer supporter because, frankly, we historically have had an employer-based system in this country with private insurers, and for us to transition to a system like that, I believe, would be too disruptive.
The challenge is, how do we get the federal government to take care of its business? I happen to be a proponent of a single-payer universal health care plan.
Hi, I'm Steve Perry, host of the Access to Stevel Show. I was going to make this little video because there's an obvious lie here. President Obama stating that he never supported single payer, and then you have him on video saying that he supported single payer. I was going to stop there, but Linda Douglas over at the White House Disinformation Office reminded me that I should always look at the context. So I did. I looked at the big picture of both speeches and found the devil's in the details. See, that's the little lie. Here's the big lie.
I want to make a distinction between a universal plan versus a single-payer plan, because those are two different things.
A single-payer health care plan, universal health care plan. That's what I'd like to see.
So here we have Obama saying there's a difference between single-payer and universal health care. But yet, in his earlier video, he's saying single-payer health care, universal health care. He's using them as one and the same. Why? Look up the definition of universal health care. Universal health care is health care coverage for all eligible residents of a political region and often covers medical, dental, and mental health care. These programs vary in their structure and funding mechanisms. Typically, costs are borne through taxation and managed at least in part by government programs. Implementations vary, ranging from single-payer health care systems to compulsory regulated multi-payer systems. That's why he's splitting hairs there. Single payer is a form of universal health care. They are not two different things. They are no more two different things than a Chevy and a Chevy Cobalt are. Not every Chevy is a Cobalt, but every Cobalt is a Chevy. Not every universal health care plan is single payer. But single payer is universal health care. What does Obama really want?
I happen to be a proponent of a single-payer universal health care plan.
Now, it's true the plan he was talking about in New Hampshire is not the single-payer plan that he supports. But there's a reason why it's dangerous to give this to this man. Because even when he admitted supporting single-payer, assuming he doesn't now, back when he did support single-payer, yeah, when he admitted to supporting single-payer, here's what he said. He would have to start with the program he has now, and then over a period of 10, 15, or 20 years, he could turn it into single payer. Don't believe me? It's right here.
That's what Jim's talking about when he says everybody in, nobody out. A single-payer health care plan, universal health care plan. That's what I'd like to see. But as all of you know, we may not get there immediately, because first we've got to take back the White House, and we've got to take back the Senate, and we've got to take back the House.
But I don't think we're going to be able to eliminate employer coverage immediately. There's going to be potentially some transition process. I can envision a decade out, or 15 years out, or 20 years out.
Want to hear more? Catch the Access to Stevel Show Saturday nights, 9 p.m. Eastern at blogtalkradio.com/The Access to Stevel. Or you can catch all the past episodes at theaccesstostevelshow.com.